everyone. I'm Josie Lathrop. I'm a program and policy analyst with the Public Service Commission. I have been with the commission about 2 years. I work on uh, broadband access and affordability across both the digital equity and the BEAD programs. Um, Christina is nicely running my slides today. So Christina, could you flip to the next slide, please? Okay, and we'll have our panelists introduce themselves. Jessica, do you want to go first?
Sure. So I am Jessica Hatch. I am the broadband coordinator for Door County, Wisconsin. My position is uh, two hats, really. So I work on broadband access and adoption with our municipalities to coordinate public-private partnerships with internet service providers to develop cost-effective fiber networks that'll meet the future needs of residents and businesses in the county. And then I also work on building partnerships across county departments and local not-for-profits related to digital skill building and supporting the digital skills building network. Our focus really is to facilitate collective learning about innovative best practices and raise awareness about digital skills building efforts in the community. Our Digital Access Coalition is hosted under the United Way of Door County in partnership with the Door County Broadband Office, my office. And we currently have 6 non-for-profits and 4 county departments involved.
Great. Catherine or Kate, do you want to introduce yourself?
Sure. Thank you for having me. My name is Kate Merton. I'm the Executive Director of Health Equity Innovation Partners, HEIP, and we are one of the founding members of the Rural Health Innovation Alliance, which is a coalition that is being built between the Mayo Clinic, UW Eau Claire, ourselves, and other partners that are coming on board to improve access to healthcare to the underserved and those in rural environments. And part of receiving improved access to healthcare is often education about how you actually do that, and digital navigation and community health workers are an important part of that. So we are building out that coalition and looking forward to participating today.
Great, thank you. And last but not least, Cheryl, would you please introduce yourself briefly?
Yes, thank you so much, Josie, and thank you everyone for having me this afternoon. I'm Cheryl Isbell with Covering Wisconsin. I'm in the Milwaukee Community Engagement Lead and Licensed Health Insurance Navigator for the state of Wisconsin. Covering Wisconsin is a program that is within the University of Wisconsin-Madison's Extension Health and Wellbeing Institute, and we are the state of Wisconsin's health insurance navigator contract agency for CMS. Primarily, my job focuses on building partnerships, educating community partners and consumers throughout Southeast Wisconsin, attending a lot of events and providing health insurance literacy to consumers in these communities, as well as just building relationships and trust with For Covering Wisconsin as that trusted source of referral to help people with health insurance coverage, either with the state or through the federal health insurance coverage programs. We do all of our work across the state in all 72 counties for free. And the way we do this is we educate, we enroll, and we help consumers be aware of how to maximize and advocate for themselves utilizing their insurance coverages. Thank you for having me.
Yeah, thank you for being here. So, as you can tell, we have just such a great breadth of experience in coalition building here. So we're going to follow the format of the other panels, and I'll facilitate a discussion with some questions, and then we'll take your questions at the end. So the first question I'd like to start with is, what traditional or non-traditional partners have you built coalitions with? And how did you and do you go about identifying partners for coalition building? And so anyone can feel free to jump in here.
Well, for my office, that was an easy decision because I'm on a not-for-profit board for early childhood education, and I was already aware of and friendly with the director at the United Way and have a history with the United Way and what they do in our community. So that was an easy ask for me when I went into my office to bridge the divide and reach out to the Door County United Way. And they have a group that they host, which is a monthly not-for-profit group meeting under the United Way. And not every not-for-profit in the county is involved, but a lot of them are. So that was an easy way for me to bridge conversations and kind of let them know what we were planning on doing, starting those conversations. And then also an easy discussion with my county departments, the Veterans Department, the ADRC, the Health and Human Services Department, just kind of making them aware that we're having these conversations, we're starting this, we're doing this coalition building, and just reaching out and explaining really what the goal was.
I would follow on with what Jessica says and said, I think clarifying for everyone that you're trying to build the bridge and finding a common goal has always been very important to us. And HIP, we've found that we'll work with a lot of not-for-profits. We obviously work with a lot of health systems and clinics, and then we leave no stone unturned when we try and find support for things. So often that does actually mean going into corporate environments and trying to understand how what they're trying to do with their business also aligns with the goals of perhaps what we're trying to do from a more philanthropic perspective. So bringing in multiple different groups, and I've had everything from sort of law firms want to jump into corporates, as well as sort of the health systems and, luckily United Way and other groups that we want to work with. So it's been highly varied and can be very diverse also, because sometimes you might be working in a state like Wisconsin, but you often find that others from outside of the state might have an interest of coming in and being helpful as well.
Yes, and with covering Wisconsin, I'm going to echo what Catherine and Jessica just shared with the non-traditional and traditional partners that we work with. We tend to work with partners that have the same purpose that they're working towards, as well as mission and vision for communities throughout the state of Wisconsin. Some of those entities might be public and nonprofit community-based organizations, hospital systems, county reentry programs, child care centers, any entity that is serving underserved, underrepresented populations of people that either don't have access to health insurance coverage or just don't have access to health care. So basically, that's the partnerships that we involve ourselves with, as far as getting into community, helping consumers with those challenges of social determinants of health. And so we partner with them, and we collaborate and involve ourselves in those coalitions that have those particular partnerships on the same program, on the same board, working towards the same mission of building healthy communities across the state.
Josie, I would also be remiss if I didn't mention, I have my county broadband committee, and we have a lot of stakeholders that are involved. So economic development, healthcare, utilities. So I have this, cohort of my committee members also for that outreach and that bridge into those stakeholders in this work as well.
Awesome. Yeah, no, I appreciate that. So I was just going to kind of recap, and some things that I kind of heard are using existing connections, using existing committees, finding that common goal or that common mission, and then kind of identifying partners from there. And then, working with partners, again, with the same purpose, same common goals. And then looking at both public and private organizations is something I heard, which I think is a very good point. Any other thoughts on partnerships before we move on?
The only thing I would mention is we discussed this when we all talked the other day that um, those partnerships that I have already have roots in the community and they have already done a lot of trust building and they know their clients and their patients really well. So that helps with that barrier a little bit, where we can at least maybe move the needle a little bit faster because this is very slow work that we do when we're coalition building and explaining to everyone what happens or what the goal is really, like what we want to get to. So that in itself is important.
Yeah, I've
Yeah,
definitely. Oh, go ahead, Cheryl.
I'm sorry. I would just like to add to what Jessica said. Um, what we try to do is also find well, we do align ourselves with community partners that have that cultural competence in knowing, the communities that they serve. They have the relationships, and building trust with Covering Wisconsin is necessary to have those strong relationships with those organizations that are working with specific populations of community members, and that we use them for networking, and we basically use each other for networking. So it's a give and take. It's not just a take all or you get all the information. So we center ourselves and build those relationships with those community members and organizations that have the trusted relationships that we can come in and tap into and share our knowledge with these organizations so that they can impart that onto the constituents that they serve in their communities.
Yeah, absolutely. So, finding those trusted partners, particularly when you're working with these covered populations, and finding partners that have that cultural competence, I think is so important, Cheryl. So, thank you for bringing that up. So the next question I have is kind of about running the coalition itself. It's a broad question. It's so who leads the coalition efforts and how is the coalition structured? And I know that that might vary based on the type of coalition. And then anything that we should know about kind of coalition logistics, like running a coalition.
Yeah, I'm happy to lead off on that, just share sort of our experience. I've had the pleasure and privilege of doing it in different states and actually across the US when it comes to coalition building. We generally run them virtually. We often find it is good to make sure you have at least one annual in-person meeting. You can never get over the importance of actually like connecting with people in person, especially kind of to Cheryl and Jessica's point, when you're trying to do community work, you shouldn't be doing everything virtually. You actually do have to meet people in person. And one of the things that we have found through sort of painful experience is that tracking your progress, even if it is not successful progress all the time, because progress is going to be lumpy in coalition building, is track it very carefully. And I think this might go into like the discussion we want to have around goals as well. So whoever that you bring into the coalition, make sure that everyone is really clear on what's happened. Make sure everyone constantly stays sort of involved as well. You never want anyone to feel left out because then you get a drain of energy from the coalition. There's just a couple of points.
Great tips, Kate. I appreciate that.
In my coalition work, we have a lead agency that can bring to the table those expertises in data collections and sharing out really relevant information to be able to help us get to our common goal and knowing who to target and where to target, and just knowing what the needs of those specific communities are by surveying the community and talking to the people that live in those communities, that have the lived experiences in those communities, that can share out which concerns are most priority to them. And so a lead agency will have specifics that they've charted, and they'll bring them to the coalition membership, and then we decide how to prioritize what are the top priorities, and not make them too long. 4 to 5 is a good number to give yourself time to be able to work on those priorities effectively and efficiently, and establishing those subcommittees that have specific duties to see that specific work is being done within those priority areas that we're working on.
Great. That's really great insight, Cheryl. Jessica, do you have any thoughts on this?
So we do have a, like I said, we have United Way as our lead organization for this, and we're still, learning a lot about this work because we're relatively new in the past, I say 2 years, and that seems like that's not new, but it really is because it's very slow work and trust building. And we utilize NDIA has a lot of resources available for the coalition work, and we offer virtual and in person for all of our meetings. And we usually get a heavier virtual attendance because we all have very challenging schedules a lot of the time. I have the benefit of just being not far from the United Way, so I try to be in person as much as possible for those so that the director and I can also then discuss maybe what our next steps are going to be. But even in the conversation that we had, yesterday, I've learned a lot just from Catherine and Cheryl on some concepts that might be really helpful for us, like having some subcommittees once we get larger and get heavier into that work. And I have the benefit also of the, in-state subcommittees that we meet and having those discussions with everyone there and being able to kind of take some best practice from them. So we're not necessarily reinventing the wheel or even inventing the wheel, but really taking some best practice from some areas in Wisconsin already have things established.
If it's okay, Josie, I wanted to add on what Jessica just reminded me of something. I wasn't sure if you wanted in this discussion for us to kind of like delve into the details of actually how you run the thing, because it all sounds good in theory of like joining a coalition and everyone's got a ton of energy. And in some cases, it has gone very well and there doesn't need to be contractual agreements. And then in other cases, depending upon the coalition, we've actually put together some light-hearted MOUs just so everybody kind of understands the rules of the road of like, I'm committing to keep having a conversation with you and I am endeavoring to get to the same goal. Like Cheryl says, having groups with a shared goal is so incredibly important, and having people who care enough just to maybe write their name down on the MOU so you all feel like you're in it together and everyone's just as committed. I say that's actually one thing that in certain places we've found particularly helpful.
That's a great idea.
Incredibly good advice, and
Yeah.
I'd never heard of that in my prior work, and I think that's, if you're finding that something that might be helpful, I think it's great to share. So some things that kind of rose to the top for me are, I like the idea of having a hybrid meeting, but I also really do think that, the idea of like having one meeting in person annually would be like maybe great. I really do think there's something about that face-to-face connection. It sounds like a common theme is kind of a lead agency. I would imagine maybe even like a lead staff person at that agency. And then I believe it was Cheryl who talked about narrowing your priorities, and I really like that advice, like finding like 4 to 5 priorities and really narrowing it down that much. And I also really like the recommendation to use those NDIA resources because they do have some really great resources compiled. And so there's no need to reinvent the wheel. So this next question that I have is also about coalitions. If there's, feel free to go off the question a little bit if it spurs other thoughts, but it's about goal setting. So how do you set and adjust goals for the coalition? And feel free to jump in anywhere.
I'm happy to go first. I don't always done this quite a bit. And I think as we discussed on our prep call, there is always an incredible amount of energy when you start a coalition. Everyone is really wanting to do the good work. So there should be goal setting for the coalition itself. And we also concentrate upon how do the goals of each separate institute or group that are participating in that coalition also get served. Because at the end of the day, if someone moves on from, one particular part of the coalition, like that individual gets a job somewhere else, you still need that institution to sort of be on board, and it shouldn't just be dependent upon that individual. So when we build the coalition goals about the work that we want to do, we kind of go back, especially if maybe you're bringing in a corporate partner versus a not-for-profit, but the corporate partner has some business directed goals that they need to like tick the box to as well. So having some very clarifying conversations up front of like, okay, this is what we all want to do, and what is each group going to get out of this, and let us document this in the progress. We talked, Jessica's highlighted this a couple of times, like progress is going to be lumpy. Sometimes it's going to be slow, and then it's going to rapidly speed up. So being able to sort of, when everyone's saying, well, my goal didn't get met yet, well, that's great. We are going to get to it, and this is where the progress is. So I would say align coalition goals to the individuals and the institutions that are participating, and making sure that is clear at the outset.
Oh, I love that advice. I love you have to think about what's in it for them, and like making sure that their organization, again, all these organizations have individual goals, and how are their goals being served?
For me, this is a tricky one because we're so new that a lot of times the goals that I'm looking at they're so basic. Like, let's get to a meeting and let's have these discussions on what is digital equity, what are digital skills, it's educational based and has been for quite some time now, so that there's a general understanding of what we're trying to achieve. Which we do, we have some funding that we were awarded under the CPF Digital Navigators grant, so we will be getting devices soon, and we will have a part-time regional digital navigator. So we know now where our goals are going to be going, because we're going to be going into distribution. We'll be going into those meetings and everything. But for a while, it was just a matter of just very basics, the education of what this work is, and really helping the partnerships that I reached out to understand that they're already doing a lot of this work. So they may not call it digital skills, they may not call it digital equity, but our veterans office is helping veterans sign up for email and then establish an account so that they can get into and access benefits. And even Health and Human Services does that. The ADRC does, host digital events and do, how to use your iPhone, how to use your smartphone, just, basic, have an email, things like that. All of our partners do something that is already in this arena, and helping them understand that what they're doing is this work that we're talking about. So we're we're just at the very beginning still, and about to like get out of the chute doing things. But I love these conversations because that was what Catherine shared with us in the dry run, and even today I was like, oh, this is perfect. So this helps, in the next step for us to have these conversations. And even like the lighthearted MOU, that's a great idea, so that they really understand, like, we want you to show up. We want you to be part of the discussions. We need you to be here.
Josie, I'm going to just pivot a little. I agree with everything that Catherine and Jessica have just stated, but I just want to pivot a little bit on the goal setting. And I think that the first goal setting has to be with you, because with that, when you put out the invite for people to join the coalition, you might get 100 people wanting to be a part of it. But the goal setting that individually that you have to set for yourself is, do I have the time commitment, to give to this group, to share my ideas and give input and be 100% engaged in the process. Can I afford this amount of time, from my regular work schedule? Is there a time that's best for everybody to meet? Those sets of goals have to be the initial part of the process, I think, before you can establish within your coalition how to get started on your priorities, because it has to be that everybody is involved. And, initially in coalitions that I was a part of, COVID hit and everything went to virtual. And we were having meetings like every 2 weeks because you didn't have that in-person connection, where you could actually physically sit down and just, off the cuff, come up with ideas or ad-libbed to someone else's idea. Now that things are so much better, having those monthly meetings, in-person meetings, is so important to solidifying goal setting. And then you can get to the next part. So
I think that's an absolutely great tip, Cheryl. I think, we all know what it's like to overcommit. And, whether it be that like board of directors position or that volunteer position or whatever it is, just realize like I'm not truly participating, I'm not adding anything. So I think really on a organization by organization or individual by individual basis, thinking about like, do I really have the capacity to meaningfully contribute? So I think that's great. So I, heard a couple of things like, how do you serve the coalition members' goals, their organizational goals? There's always a piece of self-interest there. Kind of, Jessica, I heard you kind of talk about laying the foundation through education. Sometimes you have to just sort of like talk about like what is digital equity to get everyone on the same page. Um, and that kind of reminder that people might already be doing this work, whether or not they identify as doing that work. Yeah, and then lastly, what Cheryl said about, kind of goal setting with yourself first. So yeah, I think those are all great tips. Anything else on that topic? So before we turn to Q&A, I have one last question, and that is, how do you track progress on the coalition's goals? This is kind of that evaluation piece, and as you're kind of meeting maybe quarterly or annually or monthly or whatever it might be, how often are you revisiting those goals? How are you, assessing what you've accomplished? How are you assessing where to go next? So just kind of a general discussion about that.
yeah, I would say, identifying, the way you would measure, the way we measure is have we um, made contact and had regular conversations with those stakeholders that are needed to assist in this change. Specifically speaking, lead poisoning. A lot of that's going on now in our schools. Lead testing in children was pretty much brought to a screeching halt during the years of COVID. How do we bring that back? So are we talking to our federally qualified health centers? Are we including our providers, our pediatricians? Are we including those agencies that have the ability to go out and do door-to-door canvassing? Have we connected with the right public officials to see what is happening so that we can report back on the ground, so that we can get promotional materials out to community members and families and schools and daycare centers and food banks and shelters, all of that sort of thing. So yeah, that, hopefully that answers your question, how we're tracking that. How many people have we touched? How many people and organizations are on board with this mission of abating the lead poisoning increases that we're seeing around the state right now, specifically in Milwaukee County.
Absolutely. I think one of the greatest ways to track progress is to track, for any coalition, is to track how many individuals you reached. That reach is so important.
Yeah, I was going to give the answer to this question two ways. I hate to sound like the more businessy side of things, but We often will use like a RACI tracker for like who is responsible, who is accountable, did you communicate it, and were you appropriately informed? That's like the very like, did you actually do it? We will try and do that quarterly, and then we'll make sure that the output is rolled up. But just to go back to what I think Cheryl was saying, which is the most important bit, is that you actually need to not just track like what was written down in a PowerPoint and did you have the connection, like what was the actual impact of what happened in the community? Ask those people who are essentially your customers, did you actually make any change for them? And so we will, in things that we have done previously, it's about going directly out to the patient and doing the before, what was the status before, and then what actually happened afterwards, because you can do all the sort of coalition management as you can, but it's did actually you get the good work done and making sure that you're able to report out those numbers at the end of the year in some form of annual report.
And Kate, I think it's a great tip. I wanted to pause and for myself, because I'm not familiar with this, ask you about this RACI tracker, I believe you said. Can you
It's
tell us
just
more about that?
when you've done lots of different program management, so people are responsible for things, people are accountable for things, and they're two different, responsible, accountable, two different things. And then you have to make sure that who did you communicate it to and who was informed. It's just a management tool. And depending upon the coalition, some people love that, and other people that's a little bit too rigid for them. Often we use RACI charts if there's multiple members within the coalition. If I'm running one that's just got 3 or 4 members, it's probably not necessary.
Okay, great. No, but I mean, everyone's brain works differently, and some people really love specific tools like that. I've had coworkers who have used like, Microsoft project management tools, and that's not, I don't prefer to do things that detailed, but I think some people really like that. So, Jessica, what are your thoughts on this?
Well, for me right now, this is just one-on-one touch points with my coalition participants. So, for example, we're going to be applying for this grant. So I've been doing a lot of in-person meetings and touching base with those partners because it's just easier for me to meet them where they're at for their schedules, whether it's a virtual or in-person meeting. And also, for us, this will tie into access being available and then adoption, which will start to track as construction is moving further. We have fiber connections that are going to be coming online this year, a pretty decent amount in our area. So, we know where to focus in those areas and do outreach. And we have municipal broadband committees that are also stepping into this work and kind of their own little municipal coalitions and doing meetings where they're having discussions with community members on digital skill building and how to maybe do online banking. The hospital is showing up and talking about their portal access and how to access that, and we have different areas that they talk about local IT and cord cutting and, maybe saving some money and letting go of those satellite connections for TV and teaching people how to stream. So we'll have a survey that we're going to be issuing to start doing a lot of this tracking. So we'll have a better idea of those touch points and what our impact is going to be throughout the year. So really a digital skills survey and then my connection with my coalition partners. And once we have devices here and our part-time digital navigator, we'll be tracking those meetings as well.
Great. So yeah, things I heard were making contact with those stakeholders, just sort of like the number of organizations or stakeholders you are actually engaging with. Are we including all the necessary people? The idea of like a formal tracking tool like a RACI tracker, the impact of what has happened in the community, the people that we're trying to reach, and maybe something like a survey to kind of see what the results are. Anything else we want to add on that, on progress tracking?
There was one other quick thing, and it kind of goes back to a prior question about like who you work with in the coalition. I'm a massive fan of not reinventing the wheel. And like Jessica said, there's already a ton of people out there already doing the good work. And there is nothing more demoralizing than a new group coming in and trying to like reinvent and do the same thing. So really do your homework. And you obviously missed something. So really do your homework and understand who else is already doing that good work. Can you work with them, use their experience so that when you do develop goals and you're tracking progress, you've actually got historical data from before you even began to understand what the landscape was, if you know what I mean. So the work you've done isn't just done from like your start, but from when they started before. So it all kind of builds in together, like finding the right partners, understanding their goals, and then also being able to use their historical experience to track like longer progress. That was just one thing I wanted to add in about do not reinvent the wheel. Try and find people who know who are smarter than you and have already started this work before and kind of assist and enable them to do more.
Absolutely. Yeah, I think, it's kind of like what Jessica was saying. It's, people may not identify as doing, digital equity work, but a lot of organizations have already been doing this. And so we can kind of build on that historical knowledge. So Milena sent me in the chat, we should be adding a question about sustainability. So what tips do you have? And that you can draw on your work history here too, because I know some of these coalitions are just getting kind of started. But what tips do you have for creating sustainable coalitions and thinking about longevity, perhaps after, X, Y, and Z funding source runs out, right? So that's like sustainability in funding the coalition, sustainability in the work, sustainability in staff, just kind of general sustainability. And I'm throwing that one out there. I didn't tell you I was going to be asking you that. So if you need a moment to think about it, that's totally fine.
Cheryl, do you want to go first?
Oh,
Oh,
go ahead.
oh, I was just going to say, like,
No.
sustainable is actually
Yeah.
something we spend a lot of time thinking about, whether it's community health workers or digital navigators, because let's be honest, once the grant has run out, you want to hopefully have done enough sort of employment development work so that person's time is then reimbursed through another mechanism. So I think that's actually part of one of when we pick partners to come into the coalition, who can come into that coalition who maybe is going to help you think about regulatory pathways and reimbursement pathways and other things that can enable you to take the grant money, do the good work, and make sure all of that training doesn't just then stop. It then actually becomes an employment opportunity and other things. And that's often where sometimes we might bring in corporations to say, hey, the work that we're doing at some point is going to benefit you. So how, as we're doing this, can we then roll it into sort of economic development activities and that sort of stuff? And as we work a lot with a university extension actually in another state. And when we work with them, we always say the work that we're developing for this particular grant needs to be the basis for the next one as well. And that's why tracking your outcomes is so important. So sustainability from how does it apply for your next grant? And then also economic development opportunities. That's first and foremost. We always think about that.
Great. Yeah, I love that. I think, like some partners might have that more like fiscal knowledge. Some partners might have kind of like the political lay of the land, that knowledge. So I think like thinking about what your partners know about sustainability and working together collaboratively is so smart.
I was just going to say, from an aspect of sustainability, from a healthcare standpoint, where we align ourselves with health institutes, health facilities, those priorities that we're working on that we've contributed our information and knowledge upon and how we can help, whether it's promotionally or being on different boards and helping to move the needle forward, is always aligning and being a part of having those folks in your coalition or in your alliance that can continue to carry the work forward of whatever chronic illnesses it is, whatever barrier people are experiencing as it comes to healthcare in that landscape, making sure that the funding is already going to be available, that sustainability monetarily, that you have the right people on board agreeing to help you sustain this program for 5 years, for 3 years, so that you know that you have that ongoing help, and then always having a backup plan. When someone's money starts running out and they can't continue on with the grant funding, who else has that same mission and vision and passion for the work that you're doing and the facilities, hospital facilities or clinics or whatever that you're helping, to be able to help the people that they're serving can carry on that work. So, so the money doesn't dry up and you're not depending on one funding source. As we know now, we can't do that. You know, if you're totally relying on federal funding, that could go away. So you have to have other funding streams that are committed to carrying on this good
Absolutely.
work. Mhm.
Yeah, it's so important to think of sustainability right from the get-go. I think it's one of the hardest things to think about and to accomplish is to really make these coalitions sustainable, but it's very practical to say this funding will likely never not always be here, you know. Jessica, did you have thoughts on that? And if you want to pass, because you know, I hadn't given you a heads up, that's totally okay too.
No, that's okay. I mean, it's something that I do think about and did think about because every grant has that question, right? And I also knew when I came into my position at the county, I'm just a limited term employee. So I have that issue where, I know my funding is going to run out probably in 2026 easily. So it's why I tapped United Way for this work because they always have the same goals aligned as I did with this program. And they cover all those covered populations and they work with all those covered populations. So for me, in my head, it would be part of their annual fundraising that they're doing and having staffing sustainably there for that, and maybe partnering with some of the other organizations that are involved already doing this work and can't necessarily carry some of them carry a full-time person like We Are Hope carries a couple of full-time people because there are our job office here in Sturgeon Bay, so they have that sustainability. So there's a couple partners involved in our organization that already have the funding and or do that fundraising for those positions. So I'm hoping that that will stay because they're not necessarily grant related. They're more of their local not-for-profit fundraising for those staffing positions, and they'd be happy to take some grant money while we have it, to kind of offset their budgets a little bit, but then to keep it going also, volunteers is a huge focus in the area here that we're hoping to get off the ground because we have a really high population here of very well educated retired people that are very, very active in our not-for-profits in the community here.
Yeah, you are very lucky to have
We
that
are.
population in Door County,
We
truly.
are.
Yeah, so I think, something I heard you say that I think is definitely worth, repeating is, yeah, your position, unfortunately, as an LT, it'd be awesome if you were permanent. But, maybe some of those partner organizations that are part of the coalition have other funding sources, right? So it's sort of like maybe doing that analysis of who has what as far as funding and ability for staffing. And then I think volunteers are another really great option to look at. I've been part of organizations that are 100% volunteer run, and
Yeah.
it's amazing how dedicated volunteers really can be.
Yeah.
So
Yeah, if you
anything
find their passion and that's what their passion is and they're good
exactly,
at it, that's just like the jackpot on it.
exactly. Especially when you have that highly educated, retired population that just wants something to do with their free time.
Yeah.
So any other we can turn to Q&A now, I think. So questions for this panel on coalitions. And feel free to unmute yourself, and I'm also trying to monitor the chat here. I think coalitions is a little bit more like of a vague concept for some people than digital navigators. Like we know about digital navigators, we know to ask about how much are we paying them, what are we trading them on? But coalitions, I think, is a little bit maybe of a different concept for some people.
I
So any
will repeat
questions?
what I said in our dry run the other day. I was doing this work for, 2 years or whatever, and NDIA released all of this information on coalition building, and I didn't really have an idea that's what I had been doing. So it was great to kind of find that and realize like, oh, this is what I've been doing. This is my own goal that I've been kind of like pushing forward, and find a lot of materials that they compiled nationwide on it, and best practice. So yeah, I think it is kind of a newer concept, maybe not for the people that have been doing it for a long time, but for those of us that are stepping into it.
So, a comment and a question in the chat. So Jessica from Extension recommends a book. It's Connecting to Change the World. Um, and she said it's about network building, but it's a similar concept. And Adele asks any pitfalls that we should be wary of.
I have a couple of pitfall stories, I think. I feel like I've been the one that's talked about how can a lot of us work as sort of not-for-profits, or and sometimes we might need to bring corporate partners in. One thing I have learned with coalition building is that if you do have a for-profit partner that wants to come in, you need to make sure that they're in it for the long haul and they're not just doing it because this happens to be the flavor of the month topic with them. And I think kind of just going back to what Cheryl said right at the very, very beginning, you need to make sure that people have aligned goals, not just from sort of a business perspective, that they themselves, the people that dedicate their time, do they really want to be in this? And are they going to come back, when times are tougher, money is running out, and are they really going to dedicate themselves to them? And that's sometimes where I found that kind of nice to have MOU important, because if people aren't willing to like write that down, sometimes corporates say no to that, like, okay, maybe you're not the partner that we want to have in. So that's just sort of a word of the warning, and why some of the reasons we've put some of our processes in place.
I think that's a great point.
I would say I'm too new to, but I've really enjoyed listening to a couple points that Catherine has made, that I'm kind of making mental note of, so that maybe we can avoid some of those. I think that's probably hard to avoid. Things are going to happen, but it's helpful.
I would just like to say, not so much of a pitfall, but some of the things that you definitely want to look at when you're engaging membership in coalitions is, do the membership have the empathy that's going to be needed to run this program? Can you build trustworthiness? Are they from a trustful organization that people trust them? Is the member, what's the change agent? Are they responsive, to change? What's their responsiveness? And behavior, you know, you don't want memberships that are very confrontational all the time. So, people that can control their behavior, even when you agree to disagree with some topic that you're talking about or you're going over, and you know, the willingness to engage in active listening or just joint learning, those are just some things that I think are necessary in coalitions in order to get the work done effectively and efficiently.
And I think building off of that, Cheryl, this is more just about meeting running maybe, but I've certainly been part of groups that have like sort of ground rules about, like I like that at the beginning of a meeting, setting rules of like, we're going to be active listeners, we're going to agree to disagree kindly, some of those things I think can really help, because absolutely personality conflicts and, can kind of cause some of these coalitions to spiral a bit. So we have about 5 minutes left. I do see a question in the chat from Milena. Any examples of coalition work that you have been a part of that you would kind of consider as a failure? And maybe I would add to that, like what we can learn from that.
That's a really good question. Trying to think which one. No, I'm kidding. Because we talked about on the prep call, like you have great ideas and you're going to have a timeline and you're going to hit this in 12 months. And I have an examples of where we plan to do the work in 12 months and we didn't, it actually took us 24 months to get some of the work done. I recently was involved in something actually in Illinois where we had a plan and this thing was going to get done in 9 months and it took us 18. We got there eventually and we tracked the outcomes, but we did actually have to appropriately track that, stages took longer because it actually involved another country and we didn't think about the regulatory aspects and the content, all this kind of stuff. So I have learned the hard way and been involved in things that unfortunately didn't work, but kind of like as Cheryl sort of alluded to, everything that Cheryl just said and the points you make, I 100% back them up. You have to make sure that everybody is on the same train as you, going to the same place and actually has the empathy for what you're doing.
Okay, any other questions from the group? And again, feel free to unmute. Okay, we have a question here. It's a great question. The question is, I'm going to just read it. We are in a time of governmental uncertainty. Funding opportunities are questionable. How do organizations manage coalition building when a partner is no longer in business as a result of lost finances? Yeah, I would say like look, maybe do some like mapping of like, potential partners. Have that backup plan. I think about alternative partners and try to have a deep bench of partners, especially now. It's like,
Yeah.
Kate sounds like she works a lot in these public-private partnerships and it's scary to think of like if you only have one corporate partner, right? And they're your main source of money if they're going out of business. So I would say just like off the top of my head, it seems like really sort of trying to diversify your funding sources.
I think you just answered that question.
I just can't stand silence.
I think
Yeah,
that's a good answer.
I literally just had that lived experience where part of sort of the ecosystem coalition that we'd built because of recent changes in the government, they've actually lost funding. They could no longer participate in what they had promised to do. So we kept the work that we were doing and to a certain degree involved, and we didn't have another partner that could switch in, but we actually am now trying to find an alternative funding source to supplement what is now gone. So we didn't have a backup group. We're trying to find a backup funding source.
Well, good luck with that, Kate. I think that's maybe a lesson learned how could you have foreseen that though? So
I think that this is a time where we have to think about our funding sources and our partners that are not directly in our fields, but they have again a passion for community, for the health of their community, because that is dependent on their businesses. So, sometimes you might have to go outside and build partnerships with law firms, banking industries, invite them to the table to hear about your work and understand how your work impacts the communities that they serve and how necessary it is that the program continue on and that it is sustainable now and in the future. So sometimes we have to go outside because we all know that larger corporations, they do have corporate responsibility, to their communities to be able to help fund things that are going to keep their communities healthy. So I think that one of you said that backup plan when somebody drops off, again, someone that has the same mission, vision, a different industry, but it is something that they are focused on for their community to commit long term to helping to keep the programs going that are helping the community.
Well, thank
Just
you all so
respond real
much. And
quick to what's
oh, go
been
ahead.
said
Yep.
in the chat real quick. I've never served in the military, but I've learned a lot from military philosophy, especially rolling out digital solutions in low bandwidth contexts like Africa. And I would say that, the same thing that's true for partnership building is also true for donors and donor relationships. And it's, two is one is none, diversify, diversify, diversify. All of these things are, having redundant dependencies and redundant, Jessica said it really well in the chat, contingency planning, scenario planning, all of that really serves us in such tough times.
Networking really,
Networking.
having your kind of, on the access side, we always talk about having your broadband champion, and I don't feel like this is any different, where you would have, your digital access or digital equity champion, and networking to make sure that you do have, some backup and contingency in there, for people to maybe take over that work for you. And if it's not on the financial side, which I saw the comment that popped up, and it's, through a partner that was going to be doing that work, that hopefully you have another partnership that could maybe take that over for you, because you've been having discussions with other maybe not-for-profits or for-profits, or just other stakeholders.
Well, this was a wonderful discussion, and I appreciate you all so much. It was just beyond what I was hoping for. But I do need to pivot us to our closing speaker, Alyssa Kenny, our Bureau Director. So take it away, Alyssa.
Thank you. What wonderful panels and what a great afternoon together. I just have a few remarks. I really just want to start by thanking our panelists, our keynote, and the PSC staff who have worked really hard at putting this event together, and also our interpreters who provided, an accessibility service that was just incredibly important, and their work is incredibly important and appreciated too. So thank you to everybody for making this day so wonderful. I frequently hear that broadband is sort of the oxygen of the economy. Without it, our economy, jobs, everything is not going to work. I think digital inclusion, though, and digital equity and opportunity, that's really the essential fabric of society and democracy. And so I'm so glad we spent the day today really focused on not just the wires and the towers, but how do we make sure everybody has access? And we think about the devices and the affordability and the adoption and the supports to really make sure. The other thing that just stood out to me this afternoon is there's so much good happening in Wisconsin. We're kind of a bit of a humble Midwestern group, but boy, there's some fantastic stuff, and I really hope it continues and expands. And I would not be doing my job if I did not do a final plug. Our commission has an open grant opportunity. The Digital Equity Capacity Grant for digital navigators and coalitions is open right now and accepting applications through May 20th at 1:30. I'm sure it was in the chat. I'm sure it will be in your follow-up email, but please, if you have a network, a place to share that information, we want people to know, and we want to try to get these federal funds out the doors to organizations who are doing this work so they can grow it and expand it and sustain it. So thank you again. That's it. And I think I'm last. People are nodding. So I think we get to maybe have some closing extra. There's our email, and we will make sure to do sort of a follow-up email with everyone who attended with slides and links and content tomorrow. But thank you again, everybody. Enjoy this wonderful spring day in Wisconsin.